So to recall, where we had stopped the last class. So this is the last slide we had stopped. So in the last class I had introduced you to graphites, okay, and then we spoke of the pathogenesis of graphites. What is the sphere of action? Where exactly you see graphite acting is what we had discussed in detail. And then the very important part we also spoke was physically how are they? They're very obese people, okay. And mind is what we also discussed in detail. Anxiety, anticipation, very caring, getting offended easily, very moody. And what was the character of grief we saw in graphites? Very good. Grief which was constant and grief which is prolonged. Only remedy you have is graphites. Only remedy is graphites. Okay. So, okay. In today's class we'll try to focus on the remaining part of graphites is what we are going to discuss. And under this remaining part, we will be discussing under one common heading, and that common heading will be particular symptoms of graphites. Okay. Now what do you understand by particular symptoms? Symptoms pertaining to the body, the physical body. Okay. So from head to toe, whichever organs graphites has an affinity, we will try to discuss those organs exclusively. Okay. See, you know the pathogenesis, you know the ailments from, okay. It will become very easy for you to understand this particular part. So what we will try to do is, we will try to look at the particular symptoms and we will start with head. Now before I start giving the symptoms, I'll definitely give you an opportunity. As a third year student, having understood the pathogenesis, having understood the ailments, I feel there is lot of scope for you students to answer. Okay, so we'll focus on head. Just imagine, go back to the normal anatomy, what are the parts of head, where you can see graphites affecting. All those things is what you can answer. Okay, so what do you expect under head? One possibility could be there could be headaches. Good. Okay, headaches which is more frontal. Okay, there can be hair fall. Good, very good. Go ahead. Hair fall, headache. Okay, more than grey. Don't look at my hair and answer. Okay, more than grey. Okay, there can be dandruff. Good. Think of something else. What is the primary action of graphites? Skin. Good. Very good. Your friend says skin. Beautiful. So you should focus on the scalp. So under scalp you can definitely have dandruff. Okay, there can be eruptions. Very good. Okay, there can be eruptions. Okay, there can be cysts. Good. What made you think of cysts? Okay, see, it's a psychotic remedy. So graphites has a tendency to form cysts, sebaceous cysts. Okay. So very good interpretation. We'll just quickly look at the headache. Headache, I have very few points. Headache, aggravation left side. Headache, aggravation sunlight. Headache while eating. So these are few symptoms related to head pain in graphites. But more important for you will be like what you contributed. You spoke of hair fall. Okay. Now again, when you look at hair fall, when you look at the anatomy, the parts of the skull, hair fall can happen from any part of the skull. I hope you are clear. Okay. Now graphites has a special affinity. Now what is that affinity? Where do you see hair fall in graphites? The hair fall is in the vertex. Okay. The hair fall is in the vertex. As a third year student, two more remedies you should remember. There are plenty of remedies. As a third year student, two more remedies having affinity for the vertex. One is Baretaka. Yes, very good. And the other one is Lycopodium. Baretaka, Lycopodium, and of course graphites as a third year student. I repeat, there are many more remedies. So one area is hair fall, which happens in the vertex, and hair fall from the temples. Okay. So two areas where you see hair fall in graphites. This is very important. We have patients coming, okay, and they have a typical pattern, only in the vertex, only in the temples. So you need to give importance to this particular point. Okay. Now the third thing under which I will be explaining graphites will be the eruptions. Eruptions. Graphites can cause eruptions on the scalp. Okay. It could be as simple as dandruff. Okay. Or it could be something as serious as psoriasis. And again, psoriasis, I have specifically taken an image from Google pointing the which area? Pointing the occiput. Okay. So when you have eruptions, when you have psoriasis, and the affected part is more of occiput, you can always think of graphites. So sebaceous cyst, eruptions, okay, psoriasis, hair fall, headache, all these things will come under graphitis. Graphitis head. Going ahead, yeah, we were talking of that. Going ahead, we will also focus on eyes. Again, look at the anatomy. Go back to the sphere of action, which we just had a small revision, and you can start contributing. What do you think will happen related to eyes in graphites? Okay, there can be inflammations like conjunctivitis. Okay, good. Something beyond that? Okay, there can be styes. Yes, agreed, possible. Conjunctivitis, styes. I know you have been coming fresh from the postings. So you'll be talking of all serious eye conditions. Okay, anyway. Okay, more than acne discharges. More than cataract. More than double vision. Yeah, dryness. Okay, go ahead now. See, you are talking of all the conditions you know from your after, but you are not applying the pathogenesis to the eye of graphites. Okay, eczema, good, agreed. Where eczema? Eczema of the eye? Where can eczema happen? You can have eczema over the lids, eyelids. Okay, eczema over the eyelids. Yeah, what is the point? Good. Yeah, beautiful. Don't you think that has some importance? What was the pathogenesis we discussed under a sphere of action? Graphites is a remedy which has an affinity for mucocutaneous junction. So don't you think you have a mucocutaneous junction here? Yes? So simple. Why you want to give big ophthalmological terms? Keep it simple. So you can have cracks at the inner canthal, or you can have cracks at the external canthal. So one is cracks, and then the affinity for skin. You have the eyelid getting affected. Blepharitis. Okay? Fine? Or eczema of the eyelid. Eyelashes will fall out. Falling off eyelashes. It is all possible. Okay? So we just see quickly what do we have. Cracked canthal, which we just discussed, and one of your friends rightly said eczema of the lids, that is also there. You can also have not only the canthal getting cracked, the eyelids itself can go into fissure. Okay, and one more very important thing is photophobia. Photophobia for sunlight. Okay. There are remedies having photophobia even for artificial light. Which is the remedy? One remedy which we all should know when we talk of eye. Euphrasia. Okay. So photophobia for sunlight is graphites. Many more remedies are there. And last thing, keeping its affinity as a psychotic remedy, you can also see tumors. Tumors of the eyelids. when you have benign tumors, small tumors of eyelids, somebody was talking of styes, possible, or benign tumors of the eyelids. These are few things that will come under graphite's eyes. Any confusion? We spoke of head, now we are discussing the eyes. Eyes, that affinity for mucocutaneous junction, and that eyelid, eyelashes, fine, photophobia, tumors, small tumors of the eyelids, you can think of graphites. Okay. Now, ear. What do you have related to ears? Think, see, simple anatomy, don't complicate, don't come up with big words. Fine. Ears, what do you expect in graphite? Huh? Very good. Eruptions behind the ear. Okay. Coming from, okay, chala. Eruptions behind the ears. Very important in graphites. Eruptions. What type of eruptions? Very good. Vesicular eruptions. Eruptions which discharge. And the discharge is offensive, sticky. Like honey. Fine. So eruptions behind the ears, very important. And you can also have cracks of the ear lobule going into cracks, ear lobule going into fissure. You can think of graphites. But what have I projected here from Google Images? Hearing loss for human voice. What is this? Hearing loss for human voice. What do you understand by this statement? That they have hardness of hearing for human voice. Any other voice they are able to hear. Okay. Only human voice they have issues. For example, dog is barking. Okay. There is a vessel that falls. Yeah, he is able to hear. But he is not able to hear human voice. Very peculiar. And you have better remedies. And one better remedy I want to tell you is phosphorus. Okay. So we'll go ahead. Cracked ear lobule, which we discussed just now, and one of your friends contributed that they also have eruptions behind the ears. So these are few things you need to understand. Okay. So hope both the things are clear. Eyes, yes. Okay. Now going ahead, we'll quickly look at the nose. What do you expect under nose? Simple. Huh? Okay, polyp, good. You are talking of internal thing. Let's start the outer part. Again here, the nostrils. Okay, that can be cracked. Possible, good, one. Then there can be taking that psychotic thing very seriously. You can also have growth. Like for example, you can have polyps. Again, freshly posted from ENT. You know, you can have polyps. Growth in the nose. Polyp, you can have crack of the nostrils. Anything else that you can think of? Huh? Okay, any eruptions, good, possible. Any eruptions. Acne over nose. I mean, there are girls having acne. Acne over nose. Pimples. Acne over nose. Possible. Okay. One thing that you missed, which we discussed under introduction, which we discussed under ailments from. Can I quickly have the ailments of graphites? Grief, mental exertion, exposure to cold. Can exposure to cold do something here? Can exposure to cold? They are very sensitive to cold. There are people who can take cold easily. One more thing. Hey, limit to nose. Yeah, what is it to do? What is it? Yeah. Yes, very good. They are very sensitive to smell of flowers. Okay. Graphites is very sensitive to smell of flowers. Other remedies. See, sensitive to smell of flowers, you know, smell of flowers is something many of us enjoy. In your organum there is a topic, idiosyncrasy. Okay. People who are oversensitive. People who faint from smell of flowers, they are overreacting. Okay. So idiosyncrasy. Fine. Two more remedies who can have issues with smell of flower is phosphorus and naxometa. Phosphorus and naxometa. Though repertory gives many, I am giving you, keeping third years in mind, I am talking the remedies that are there in your syllabus. Okay. So we'll go ahead. Absolutely right. Cracks is what nostrils can be cracked. There can be eruptions over the nose possible, and this is not graphites. This is not graphites. Why? She's enjoying. Beautiful. Good observation. She's enjoying the smell, you know, which many of us do. And unknowingly, if she smells flowers, and then there is a possibility she might faint or something might happen. Very, very sensitive to smell of flowers. In brackets, phosphorus and naxometa. And the third thing, one of your friends rightly said is tendency to catch cold. They catch cold very easily. Can also be graphites. Okay. So this is related to nose, and we'll quickly talk of face. Again, I'll keep it open for you. What do you expect under face in graphites? Okay, acne, good. Acne, eruptions. Okay, eruptions, acne. Can you think of things beyond acne? I'm happy you thought of acne. Anything else? Anything else?
Cracks in the cutaneous junctions.
Okay, so what is that crack? Where do you have the cutaneous junction? The mouth, corner of the mouth can be cracked. Good thinking. Acne. See, one more very important thing you have in graphites is cobweb sensation. What is it? Cobweb sensation. They feel as if there is cobweb on the face. Here it is a reality. Fine? So they have a sensation as if there is something, as if cobweb is on the face. Can you think of any other remedies? Beautiful, good. I like the speed, I like the sound. Good. Barataka. Before the question is completed, you have the answer coming up. Before the enemy is loading his gun, you shoot him. Beautiful, good. Barataka, one. Then second. I don't know if that's there in your syllabus. It should be there. It's a rare remedy though, and the remedy is bromium. I don't know if it is done. Okay, Barataka, bromium, magnesium carb, sulfuric acid, and there are many more remedies. Okay. So cobweb sensation, and another very important indication which you have contributed is acne. Pimples. Okay. Is this blocking? It's not clear? Okay. So pimples, acne. Any quick remedies for comparison? Pimples? Huh? Berberis, vulgaris or aquifolium? Berberis vulgaris has a special affinity for kidneys. Berberis aquifolium is a remedy for pimples. Okay, think beyond. Calibrum, good, agreed, calibrum. Berberis aquifolium. Then any other remedies? Heard of arnica? Yes. Beautiful, good. I'm happy. I mean, see, that's the, when your teacher enjoys taking class, it's a beautiful feeling, and thank you for making me enjoy my classes. Because of the answers, the speed with which you interact, that also gives me a nice feeling, Good. So arnica. When I said arnica, your friend immediately said symmetrical. What do you understand by this? Yeah. So left cheek, right cheek. Left cheek has 4. Right cheek also has 4 in the same areas. So this is symmetrical. Same. Okay. If you are lucky, when you get a person having eruptions which are symmetrical, the only remedy you should think of is arnica. Especially pimples. Pimples which are symmetrical is arnica. Good. Okay. We'll go ahead. In graphites, the pimples are seen mainly in anemic girls, pimples which are irregular, and pimples before menses. These are the pimples indications, acne indications of graphites. Going ahead, one more point you have already covered. I have something in between. The lips in graphites can go into cracks. Again, homeopathy offers lot of remedies for dry, cracked lips. Can I have some remedies, quick remedies? Huh? Okay, nitric acid, petroleum. One more remedy, I mean there are plenty. One more remedy, is natrimure. What is the speciality of natrimure? Crack in middle of lower lip. It's got a beautiful meaning why natrum has a crack. I don't know if you are ready to understand that, but anyway, do remember natrum is a very good remedy for crack. Okay? Fine? Must be, once you come to final year or internship, I will give you an explanation why natrum has a crack in the lower lip and especially in the center. There's an explanation, there's a meaning. Okay? Now, last point that you contributed was its affinity for mucocutaneous junction. That it causes cracks. And a very important remedy will be nitric acid. Nitric acid. Okay. We will quickly look at the symptoms related to GI. From the knowledge of pathogenesis of graphites, you already know graphites has some action on the GI. Okay. So what was the action that was mentioned? It causes atony. It causes weak digestion. And it will also cause constipation. The other end. Okay. So what happens because of this weak digestion? The food that you are eating is not getting digested. So, okay, see, assimilation happens after digestion. No? Okay, food is not getting digested at the first step. Only after it gets digested, the process of assimilation starts. Correct now? So here, the digestive system, the stomach, when you are looking at the symptoms of stomach in graphites, there is weak digestion. There is weak digestion. Indigestion. Okay, so what happens because of weak digestion? You will have sour erectations. Okay, you will have bloating. You will have uneasiness. You can have decreased appetite. Okay, so these are few things that can happen. Now I hope you are understanding the beauty of materia medica. See, this is the beauty. In first year, if it is graphites, you will not understand graphites to this extent. Now that you are getting clinically exposed to different subjects, your understanding of materia medica will be way ahead. Okay. So what I was trying to tell you is, because of weak digestion, okay, there can be, I'll come to this point, gastric complaints which mainly comes up from suppressed eruption. And suppressed eruption was an ailment of graphites. Okay, was an ailment of graphites. So after some skin eruptions are suppressed, the patient will land up with gastric issues. Okay, so this is what you need to understand. And what we also saw was there is lot of gastric issues, there is indigestion, there is acidity, there is sour, belching, all these things coming up. Indigestion, sour, because of that weak digestion, there can also be foul, bad smelling erectations. Clear? Boys? Okay. Now very important, what you also have here is pain. Pain in stomach is called gastralgia. Okay. So this gastralgia in graphites is better by eating. As a third year student, what should be your immediate interpretation? Very good. As immediate as that. As fast as that, duodenal ulcer. Good. So when you look at your clinical practice tomorrow, graphites can be a very important remedy for duodenal ulcer. We spoke of a remedy very recently for duodenal ulcer. Better by eating. Better by eating. I gave you a clue, a recent remedy. Better by eating. Huh? Better by eating, anakade. I know, I also did ignitia recently. But it is not ignitia. What is ignitia better by eating? Okay, ignitia is also better by eating. But how is it different from anacardium? How is it different from graphites? Ignitia will not like bland food. Stomach is upset, and what will Ignitia want? Ignitia wants something spicy, something heavy, biryani, something which is very spicy. And you can't take that as a normal person because your stomach is upset. But Ignitia is better only eating that kind of a food, and that is a contradictory symptom in Ignitia. But graphite does not require a spicy food. Graphite just requires food. I hope you are getting this point. See, you should understand so that your future journey with homeopathy will become very smooth. You will not have many hurdles if you understand concepts better. Okay? So, better by eating, duodenal ulcer, absolutely right, better by eating. One more remedy is graphites. Not only better by eating, they are better by drinking. Drinking what? Drinking milk. Gastralgia, better by drinking warm milk. Should I repeat? Gastralgia, better by drinking warm milk. Okay. Any remedies you can think of as a third year student? There's one more remedy which is better by warm milk. And that remedy is, I heard it right. That remedy is chelidonium. Gastralgia, better by drinking warm milk. Aggravation milk. Okay, don't keep it so simple. Very good. Natrum ka. That's the remedy I wanted. Natrum ka. See, Nethusa, any damn problem is aggravated by any form of milk. Okay. When I am specifically asking you about stomach, the remedy will be natrum ka. And when you come to final year, you will also be told of another remedy, and that remedy is magnesium ka. Okay, magnesium ka. Please do remember. Okay. So, we are here, we are talking of gastralgia, better by eating, and gastralgia, better by drinking warm milk. Warm milk. Okay. We'll go ahead. You already know that this is a remedy for which ulcer? Duodenal ulcer, because they are better by eating. Not only duodenal ulcer, it can also be a remedy for cancer. Cancer, I have a extension there. What is it? The authors have not used the word cancer of stomach. The authors have not used the word cancer of stomach. The authors have used the word cancer of pylorus. Going back to your anatomy. Body, fundus, pylorus. So this affects the pylorus. Cancer of pylorus. It can be graphites. One remedy can be graphites. Okay. I don't know how clear the image is, but what you see is emaciation. Is it ringing some bell in your mind? Why? No. Is this physical appearance giving you some idea, some contradictory thing? How is graphites physically? Obvious. But what is the image I am bringing in here? I am bringing in an emaciated picture. Now what is it that you have tomorrow? A man who was obese, okay, because of gastric issues, he becomes emaciated. I'll read it from the source books. Stomach disorders with rapid emaciation. Sir, few months back I was not like this. I was very fat. And once I started having stomach issues, then he has started rapidly losing weight, losing flesh, and he has become emaciated. This is the situation in graphites. Okay? If I come for your viva, these are the questions that I might be asking, and these are the questions that will carry higher marks. Okay? Then, aversion, meat, fish, cooked food, salt and sweets. The list of aversions in graphites, and one very important aversion is sweets. Aversion sweets. Okay? Though they also have fish, cooked food, salt and meat. These are the aversions you have in graphites. Okay? Clear? Very important. Stomach. Moving ahead, we'll look at the abdominal symptoms. See, I'm going very systematic, started from head, then we looked at the eyes, we looked at the ears, nose, mouth, okay. Then we are looking into the JT, we are done with stomach, and then we are looking into the abdominal complaints of graphites. Okay. Under abdominal complaints, what do you have here? Distension. Weak digestion giving rise to distension of abdomen, flatulence. Okay, food is not digested, food is getting fermented, and gas formation. Okay, this is how you need to connect from your knowledge of physiology. Done? Done? From your knowledge of physiology. So abdomen is full. So what happens when abdomen is full? He is not able to have anything tight around his abdomen. He wants it loose. Which are the remedies who want the abdomen loose? Naxomica, a better remedy. Lacasis, good. Better remedies. Lycopodium. Is lycopodium done? It's done in second year. Good. We are in third year. Don't ask us second year remedies. It's below our dignity. So lycopodium. We should not forget. These are all key remedies. Lycopodium also, after the food, no, he wants it loose. He might remove his belt. Okay, that is because of gas. How is it different from lacasis? So lacasis, irrespective of food. Okay, the problem there will be the nervous irritation. It's not necessary that in lacasis it should be after eating that they can't tolerate tight. Anytime they can't tolerate tight. You getting my point? Tomorrow somebody comes and tells, sir, I can't tolerate tight. What should be your question? When is the tightness more? Sir, after I eat, then you have all these gastric remedies. You have Naxomica, you have China, you have Lycopodium, you have Graphites. Sir, whether I eat or not, I can't tolerate anything tight. Is more of ophidia. In ophidia, it is a nervous phenomena. In all these remedies, it is more of a gastric phenomena. Are you getting this point? Very, very important. Okay. So, going ahead, flatulence, can't bear tight clothing around the waist. Very important. The last part of gastric issues in graphites, constipation. From the image, you can know how much the person is going through. Very bad constipation. They have to strain a lot. Hard stools. Okay. Absolutely no. The stools come and settle there, but there is no arch. Or he has to strain for long so that the stools come out. Knotty stools, large stools, difficult, stringent, slimy. This is how books give you about the character of stools in graphites. Okay. There is something else that I need to add from the source books. Constipation, aggravation during menses. I told you, graphites is predominantly a female remedy. Okay, so you see a lot of things surrounding the women. So constipation during menses, when the menses get suppressed, constipation will come up. And one last thing I want to highlight here is constipation instead of menses. Please understand this statement. What do you understand from this? Constipation instead of menses. Meaning? So the lady during her menses, she would have had, generally she's been having regular stools. During her menses, for those 4 days, she is constipated and she's not getting menses. Okay. So instead of menses, she's been constipated. Done? And why I am giving so much of weightage here in graphites is, this is the only remedy in your Material America. So you are lucky. Tomorrow you have a patient coming to your clinic with this scenario where the lady says, sir, 4 days I am constipated and I am not getting my menses. After 4 days my stools become normal, but no menses coming up. So probably there, graphites can make the trick, make the wonders of getting her menses regularized. Okay, clear? Okay, so this was the GI. Now we'll quickly look at the male. Before I show the images or before I start contributing, what do you expect under male? We discussed on the pathogenesis. Okay, there is sexual debility. There is sexual debility. At the same time, what is the dangerous combination you have in graphites? They have desire, very good. They have excess desire. Fine. But body is not cooperating. We also have this situation in Lycopodium. Lycopodium also has excessive desire. But when it comes to performing, he is a big failure. That's why commonly when we see a Lycopodium wife and husband, Lycopodium husband and his wife moving around, and if a Lycopodium patient looks at the girl, what will be the statement given by husband? Don't worry, you will only look. He is harmful. Is the dangerous statement the wife gives with her past experience. Okay, so Lycopodium will have excess desire, but they cannot perform. Here, there is sexual debility. And person will have issues. See, sexual debility with increased desire ejaculates too early. Premature ejaculation. Too quick. Or he might have an erection, but when he is trying to have intercourse, he might have the erection coming back to the normal state. Okay? Right? So this is male. Now female, what do you expect in graphites? There's plenty that you can contribute when it comes to female. Very good. Yes, your friend has a point. We have set of things that happens in graphites during menopause. What was one thing which happens only in graphites during menopause? Yeah, he has the answer. Wounds open up. Cicatrices open up during menopause. Good. So one is menopause. Other than menopause, what else you have in the female? See, why I have put this question to you is again because you are a third year student, you are studying obstetrics, you are studying gynec, and luckily you are also posted there. So keep the pathogenesis of graphites under the background and please start thinking. Answer could be right or wrong, don't worry about the answer. If it is right, very good. If it is wrong, we are not punishing you. But at least cultivate the habit of thinking. What could be the probable things that can happen in graphites women? Menopause, absolutely fine. I got nothing against menopause. Huh? Oh, very good. Why cyst? Okay, good. Now you come to the point. It's predominantly psychotic. Cyst where? Oh, remember? Oh, okay. Cyst can happen anywhere. Ovarian cyst. Polycystic ovaries. So graphites can be a very important remedy for PCOD. And if you look at the graphites physical appearance, many times they sync with PCOD. Yeah, that will come later, but if you are looking at the psychotic picture of graphites, they are all obese, they have gained lot of weight. What is it called? The dark pigmentation? Acanthosis nigricans, it's all there. They look very dirty, the look. And you also see PCOS, polycystic ovarian syndrome, where you have hirsutism, all those things happening up, male things coming up. So PCOD, PCOS, beautiful, good. Anything else that you can think of? You said something, I was not in a position to hear. Huh? What is it? Okay, good. Don't directly go to the nipple, we will finish here and we will come back. Yes, there's a point, what your friend is trying to tell you is, nipple, mammy, can be cracked. Good, I have it.
And mucocutaneous junction will get in.
Okay, for example, labia. We are talking of female genitalia. Okay, so like for example, that area where it meets, okay, there again you can have cracks. Genitalia coming in contact with the skin, that part can be cracked. Possible, good. Anything else? Okay, eruptions over vulva, yes, possible, good. Eruptions over vulva, cracks, cracked nipple, ovarian cyst. You are limiting only to ovaries. how can you miss the main part, uterus? Okay, there can be fibroid, there can be uterine polyp. Okay. See, now this is what I was trying to focus. The female genitalia. Okay, ovaries, uterus, and of course the fallopian tube. So menopause is what we already discussed. There can be red discoloration of face, leukorrhea, metorrhagia, obesity, wounds separate during menopause. Okay, only remedy. And menses, if you look at the character of menses, because of the pathology that you are talking of, PCOD and all, menses can be late, scanty, pale, irregular. During menses, they can have a lot of things. They can have painful hoarseness, coryza, cough, morning sickness, sweat, swelling of feet during menses. These are the few things that can happen during menses in graphites. Yeah. When you look at the other part, ovarian and uterine tumors, we are talking of fibroids, we are talking of cancer, PCOD, PCOS, you can add, okay? And eruptions, nicely told by your friends, eruptions over vulva or cracks, fissures. And this is what your friend was trying to contribute. Mammae, you can see sore cracked nipples, practically many cases, especially in nursing women, you know, mother will have a lot of pain feeding the child. Graphites can be beautiful remedy. Okay? Cancer of mammae is also a possibility. So these are few things that you can expect under female. Last area, skin, very important area. Important area both for your practice and for your theory, both. Okay? Not that what we have covered before this is not important. It's also very, very important. But one question that can come up in exams will be skin affections of graphites. Okay? That will be your immediate target exams. And other things can come up for 3 marks. They can ask you female, they can ask you gastric, they can ask you ailments, mind, all those things for 3 marks. But one 5 mark question is skin. Now tell me, how do you answer this question? Skin affections of graphites. See, before you start shooting with your answers, always have a pattern and always have a method. When you go with a method, it will be very, very systematic. Your presentation will be beautiful. It will be easy for me to correct. I also have my selfishness there. Now before that, you will not forget. So please be very systematic. Okay? You can either go with ailments from or before ailments from pathogenesis. Acting on skin, what will graphites do? It will cause eruptions, it will cause eczema, it can cause thickening, hardening, induration, roughness. Fine. So if you have all these things, now you can start applying it. So first thing will be, it is a deep acting remedy. Acting on skin, it causes the following things, 5, 6 things, whatever you have. And then you apply that from head to toe. Head to toe we have already covered. Now, I'll come back to you. It can also be a very good revision for us. Boys, acting on head, under skin, what do you expect? Don't tell me headache, don't tell me vertigo. Under skin. So, it has a special affinity for oxycode, causing eruptions, causing psoriasis. You can also include hair fall under skin. You can include dandruff. Somebody was talking of dandruff. You can talk of dandruff. You can talk of hair fall under skin. Under eyes, what do you mention? Eruptions of the lid, cracks, growth over the eyelids. Fine. Done. Ears, eruptions behind ears and cracked lobes. Good. Is it not easy? Instead of binating, graphites, skin, honey. So the girl will not know if you are calling her or if you are reading graphites. It will be a problem. So like go step by step. Face, what do you expect? Acne. Good. Acne. What else? Face. Okay. Red discoloration during menopause. Cobweb sensation. Cracked lips. Cracked corner of mouth. Okay. And then nose. Nose also had eruptions and cracks. Yes, cracks. And lower down, we are talking of female genitalia. What do you see? Acanthosis, hirsutism, discoloration, and then you can also see eruptions over the vulva. Okay, all these things. And hands and legs. Yes, rough. Yeah, I'll come to that. That's a very important point. Hands and nails, what you have is rough skin. The hands, I told you, when you shake hands with a graphite patient, it's not as smooth as it should be. Very rough. Okay? Rough skin. And the tips will be cracked. The heel can be fissured. Cracked heels. Cracked tip of the fingers. And a very important point is nail. Fingernail, toenail. You have a lot of things in graphites. So what are all the probable things you can expect in graphites? You use one word, thickening. The nail can be thick. Okay? The nail can be thick. The nail can be deformed. Okay? Deformed nails, brittle nails, meaning it falls easily. Like you cut one part of the nail, the other part already breaks. Very brittle, or it can be hard. Okay? Both possible. And unhealthy nail. There's one more condition, ingrowing toenail. As a surgery student, you would have studied this. You would have seen your postings. What do? They remove that nail. Okay, ingrowing toenail. A better remedy? A better remedy. Silicea. Ingrowing toenail. For thickened nail, deformed nail, it can be anti-code. For an ingrowing toenail, nitronure, silicea are also the medicines you can think of. Okay. So from head to toe you think of all the conditions. Eczema, psoriasis. Okay. And eczema, what type of eczema? Weeping eczema. Weeping eczema. See, eczema could be dry, eczema could be wet. Mainly wet eczema, where you have discharges coming up. Okay, which are sticky, yellowish, honey-like, offensive. You can think of graphites. Dirty eruptions, dirty looking people. Okay. Anyway, we'll again quickly look at all these things that we spoke just now. Head, psoriasis, eruptions, eyes we have discussed, ear we discussed, nose we have discussed, acne. Acne mainly in young girls. Acne which is irregular. Acne before menses. This is what we will be writing. Okay. And you also have fingertips, palms, tips, soles, cracked, rough. Okay. And this is what nail, if you just see here, these are not the normal nail. They are thick, deformed, thick nails, ingrowing toenails. You can think of graphites. Okay? Yeah, I forgot this. Keloid. Cicatrices, keloid. Okay? We saw this. Tendency for keloids are old scars ulcerate. Old scars, they ulcerate, or old scars, they open up. Okay? These are few possibilities you have in graphites. Okay? And foul acrid foot sweat. Again a better remedy. Which is the better remedy? Foul foot sweat. Silicea. Is silicea not over? Over. Please don't, over means don't discard. When I used the word acrid foot sweat, I thought I'll hear a bomb, I'll hear a loud noise. Silicea is the remedy that should come to mind. Okay? And eruptions with moist, sticky discharges like honey, yellow, fissured, cracked and eczema, thick thickening and induration of skin, hard, rough skin. This is the explanation you need to remember. And one more thing that I have added here, eruptions with moist, sticky discharge, fissures, cracks and eczema. No, this is a repetition. And it is worth if it is repeated because it is important. Okay? It is important. Done? And so skin, you will have to focus more here. And the last thing here is the modalities. Okay? You know, Graphites is a chilly patient. So cold, and you saw a lot of symptoms aggravated during and after menses. Very lazy guy, motion aggravates, suppressed eruption, empty swallowing, fatty foot, hot drinks, warmth of bed, night, wet feet, scratching. These are all aggravating factors. And what ameliorates is open air, hot drinks, and what is that hot drink and what is that symptom that gets better? Gastric, better by warm air. And of course you have eating amelioration. Okay? And eructations, they feel better and they feel better by touch. So these are few important points of graphites. Okay? Any questions? Quick questions? Before we conclude, we'll take 2 more minutes. We'll look at the key points of graphites. Okay? So in today's particular symptoms, we focused on head. And what was the important points under head? We spoke of headache. Which side? Left side. And we also spoke of its affinity for scalp. There we discussed about eruptions. There we discussed about hair fall from buttocks or hair fall from temples. Okay, good. And eyes? Okay, that eyelids fissured, blepharitis, affinity for the canthi, photophobia, tumors. Good. And nose? What were they sensitive to? What? They were sensitive to smell of flowers. And they also had the tendency to catch cold easily. Okay. And what were the aversions? Meat, fish, cooked food and sweet. Character of stools, constipation. What is that symptom that will happen instead of constipation, instead of menses? And female, we saw a lot of things. Okay, done? Female, we saw a lot of things. On ovaries, what did we see? Cyst. Its capacity to cause cyst and dissolve cyst, like PCOD, PCOS, uterine fibroid, uterine cancer. These were few possible growths we saw under female genitalia. Okay. And last area which we extensively discussed was skin. Okay. Remember the pathogenesis, what happens and which are all the target areas and what all can happen in those target areas. So if you understand and if you start writing, I don't think it will be a big deal. You can remember and you can reproduce all the things in a better way. Okay. Any quick questions? Behind? All clear? Done? Okay. If it is clear, we'll stop the class here. Next class, as I was trying to tell, we'll try to take up either carbohydrates or petroleum. One among those, because we'll be continuing with carbons. You can go through petroleum and carbohydrates. Let me see. On that day, whichever remedy we feel like, we'll start off that particular remedy. So, thank you. Thanks.